And who do we have here today? Introduction wise.
Wait, one second, I'm waiting for him to tell us we're live, although it says we are. Can I go ahead and start?
Just one moment.
It says, oh.
All right, we're ready to begin.
Thank you. All right, I will call this Left One Disability Board meeting for October 13th to order. We have an agenda in front of us. We do need a motion to approve that agenda.
So move.
Great. Do we have a second?
This is for October 13th meeting, right?
The agenda is for today's meeting.
Right, so not,
You're right. I said October 13th because I was reading right from the thing, and you're right. It's January.
there you go.
It is January, what is it? January 12th?
Well, yes, correct.
This is the January 12th meeting. I'm sorry.
I'll second.
Thank you.
Thanks, John.
Any comments or questions? All those in favor, please say aye.
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 All right, motion carries unanimously. We have a quorum. I think we have everyone except Michael, I think.
Correct, he's out of town.
Okay. We have the minutes from the last meeting. We need a motion on those as well, please.
I'll make a motion that we accept the minutes or approve them.
I second it.
Okay, any discussion? All those in favor, say aye.
Aye.
Any opposed?
Aye.
Hearing no opposition, motion carries. We have approved minutes. All right, moving on to business items. Review and approval of left one claims.
Okay, so for the month of November, I received a few claims, and per our policy update to delegate authority up to $3,000 from the board to the Left One HR liaison, which is myself, Jennifer Schaefer. I was able to approve these and forward them directly to finance. So the first one that we received was for $1,440.13 for an outpatient procedure. The second one was for $1,669, and that was for a tissue exam with pathologist and immunocytochemistry. The third one was for $821.03. That was for massage. The fourth one was for $130, and that was for dental work. And then the final was for $125.54 to reimburse for dental premiums.
Anybody, any questions or discussion?
I have none.
I just want to ask Jenny, if I understand these expenses and you have the authority, of course, but are members being encouraged to go through our cities, regions?
Yes, that's correct. All of these were run through insurance previously, and they, the two more substantial, the first two items were denied by the coverage, and so it was picked up by the Left One board.
Got it. Thank you.
Yeah, you're welcome.
I would move to approve.
We don't need to.
No.
We don't even need to take action. It's within our authority, so we don't need to do that. Yeah, great. All right, we'll keep moving then. Review recommendations for updates to the delegation of approval of claims.
So you guys should have a copy that I emailed you of the update to the policy. This is what we spoke about at the last meeting, just to update the meeting frequency. So in our policies and procedures, it listed that we meant monthly, and we changed that to quarterly.
Yes.
So we just need to review and then have a motion and a second to carry those updates to the policy.
Any discussion on that? Is everyone comfortable with moving it to quarterly? We can always call a special meeting if it's needed for anything.
Right.
Otherwise, if everyone's good with that, we would need a motion.
Make a motion that we move the meetings to what is written there in the policy.
I second.
Great. Any discussion? All those in favor, say aye.
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 Any opposed? Okay, motion carries unanimously. Now this agenda actually is really the October agenda, the one you handed me, by the way.
Okay.
Is there anything else on new business? I don't think there was.
No,
That was
no,
it.
that was, yeah.
Okay, Anybody have anything for the good of the order?
Yeah, just a couple quickie little things.
Sure.
Under section 3 on that claim form, Jenny, I understand probably the more preference would be simply to email you with documents in regards to really not having a pre-described form, right?
Yep. You
Okay,
can just go ahead and send that to me. Email is the easiest way and the fastest for processing, so that absolutely works for me.
great, great. And let's see, I had another question about, let's see, was section 4 and how it had something to do with how to determine which one the city will cover. And I got to get my policy out again. I wrote this down and then I got to try to remember. Do you have that handy? Section 4, item 5.
Let me
The
pull that.
denture procedure provision and the long-term care, we're talking about
So what is it?
the policy and procedure document where section 4 talks about the denture provision and section 5 is long-term care.
Yeah. Maybe it had to do with if a member needed to go to a fully certified, nursing home kind of deal. How would the city determine which one it would be? Does that need to be in writing when it comes to looking at the average cost of these, looking at the high and low, and then deciding on a medium? Or did we ever approach that, or do we need to somehow make sure that that's going to be the way it is? It's not writing, but does that seem reasonable? You see what I
So-
mean? I mean, you make a note of all the different levels, and that's the most serious, of course, where a member might have to go into a fully certified care center. And then how does the city determine which one it would be, or which one will they actually cover?
Well, I could chime in with my opinion on how I'm reading the current section 5 on long-term care as it stands right now. But it talks about first that we would prefer that, if possible, members, the board prefers for you to be paid for in-home care rather than nursing home care. If not
Absolutely.
medically possible, though, we have some language about there needing to be at least 2 activities or daily living. You're unable to perform at least 2 activities or daily living things that are deemed by probably a medical professional that is indicating why you would have to go into that full, long-term care facility. And then it just says the board reserves the right to approve or deny home health care reimbursement based on the findings. I would say that if we have an existing board member that does have medical documentation that shows they have to go into a long-term care center, at that point in time, we would review, what the cost is, what, the insurance is covering for the UNUM side of things, and then what that looks like based on that individual's medical. Because we only have 10, 11 existing members at this point in time on our board. So, I don't imagine that if it is medically necessary, that there's going to be a whole lot of circumstances where we would deny somebody the reimbursement from the LEOFF funding. But at least the way that it's written right now, it just has some definitions, and I think we would probably just bring that cost and recommendation before the board, because it's going to be in excess of what we've been, granted authority to approve. It's
Well, and
UNUM's
you,
got like 6,000 for most of our members, right, to cover, and most long-term care facilities monthly are like 10 grand
Yeah.
last time I checked.
Yeah,
So
it's expensive.
yeah,
well, I couldn't recall, you came from a jurisdiction where you had some experience and background on this left one?
Mary Ann did, she was the left one liaison for Edmonds. We did have a left one board in Kent, but our benefits manager administered the board. I would just sit in on some of the meetings when our members would come through for reimbursement.
Right.
So I'm not sure offhand what Kent's stance was on long-term care, but you know, I don't recall there being a whole lot of pushback when it
No,
came to the city.
And I understand, and I don't mean to prolong this. I just wanted to, God forbid, a member has to go into a long-term care facility. I just want to know that there's that, you know, they're not going to end up in Ruland Gardens,
Right,
which
right.
is a very low end. I've been in there, and I wouldn't want my mother in that place. But
Mhm.
I'm just saying, I want to be able to make sure our member has, you know, at least a mid-range, if not better. So maybe
Yeah.
that's a board
Off
decision.
of that, remember, they have $6,000 a month from the policy.
Yeah,
I think that's gonna probably get them a little better than Rulon right off the bat, but
Right, but because most good long-term care facilities are going to be pretty expensive. I would say if we had a member, and maybe this is something we look into adding into as like a side note in this section. But, you know, in the event a member has, you know, is medically deemed necessary to go into long-term care, this would be one of those special meeting reasons. You know, we would call a special meeting to address that request right away. So they're not waiting months for us to approve,
absolutely.
you know. But I think that's probably the only recommendation I would have at this point for that section is just, we have this is one of those reasons why we would have a special meeting.
got it.
Can I speak to? This is Smitty, sorry. So the trend right now is that people in general, like in society, what they're doing is what's called age in place. And I know that you were recommending that them do home health care first, which was the first recommendation. And then if it's medically necessary that they need a facility, then they go that direction. For you, Ed, it was talking in here about an independent assessment agency that may go out and do an assessment of the facility to ensure that, you know, they're in a safe place and all that. I remember we were at a few of the conferences and they had concierge care advisors come and they were advocates for people like our members, which was a good organization, you know. We want what's best for our members, definitely. So I agree with all of this. I did have a question. A lot of times if somebody goes into home health care, the VA tends to tag a family member to cover some of these tasks, whether it was the homemaker to where they're cleaning or you know, doing minimal care for the individual. Is that something that would be covered if the family member was the caregiver? Did it have to be an actual organization or medical company come in to do that work? That would be my question.
And may I say, a friend of mine, another officer who's left one person out of Olympia PD, is currently having family members that support in the city is paying them. And that's just an example of Olympia. I'm not suggesting we do that, but I'm just saying he is being cared for, and plus some outside nursing coming in as well. So that's that they do.
Thanks,
Thanks, Ed.
experience being that, you know, I'm in the insurance business for 30+ years now, and I've done a lot of long-term care. Most long-term care policies, and I've not looked at the unit policy, but it probably does have a provision for some level of that. That's fairly typical in a long-term care policy to reimburse people doing that kind of work, family members and stuff, because it's usually far less expensive for the insurance company than bringing in professionals. So there's usually that's usually in the policy, in a long-term care policy. The other part to that I would just add is when we talk about the 2 activities of daily living, that's gonna be the definition in the Unum policy anyway. So if they're medically qualified to receive benefits on the Unum policy, then they would definitely meet the standard to receive benefits from LEF one as well. Because that 2 activities of daily living is pretty much the standard for all long-term care policies. So I think, that's it. If they qualify for Unum, they're gonna qualify for us to make that, to take care of the difference, I think, without a problem.
Were you thinking that there would be
Thank you.
need to update the policy regarding that under those circumstances?
I don't really think there would be a need to update, other than like, maybe if you wanted, and I don't know that we need to add anything to call a special meeting, because we can always call a special meeting at any time. But I do think that that would be definitely a sufficient reason to call a special meeting, just because obviously we don't want to leave someone waiting.
Right.
If
Yeah.
they need care, we want to be able to make sure they can get the care, and it's clearly going to be above the $3,000 threshold
Absolutely.
pretty
Yeah.
quickly.
I like putting something like that though in policy. I understand it'll be in minutes, but in the event we had turnover or, somebody wasn't in attendance, so we have somebody new. It's nice to have it just like as a bright, this is a qualifying reason for calling a special meeting.
Excellent.
Then, any future person who's on the LEF one board assisting with these claims can just go, oh, we got a claim for long-term care. It says right here, we're gonna need to call a
Yeah,
special
'cause-
meeting.
Right, none of us sitting on the board at the time, who
Yes,
knows? You never know in the
Exactly,
future.
yeah.
Yeah,
I
no,
plan on being here a long time, because I have kids that are 2, so I will not be retiring anytime soon, but
Well, good.
yeah.
But yeah, no, I think that'd be good to add, and then I think we
Yes.
can review it at our next meeting, but I think it's pretty much a no-brainer, yeah.
I will go ahead and add that and then have that ready for you guys to review it, then review and approve or suggest changes at the next meeting.
Very good.
Great, thank you. And just just a quick one. And first off, I gotta thank you, Jenny. You're just a breath of fresh air to this committee. And
Yeah, agreed.
I gotta tell you, we haven't had that in the past, and you're on top of things and you're very well organized. Thank you so much for what you do.
Thank you, I appreciate that.
And then my last thing was, I know that Regents Med Advantage covers some vision things. I'm not sure I haven't had because I only buy reading glasses out of my own pocket. I don't care less about that, but I know they do cover some eye kinds of care. And I hope our members read into it and get that first before they start invoicing the city. So the question came up the other day from one of the members that called me was about this laser stuff. Now, I don't know if left one boards cover that anywhere in the state. I haven't taken the opportunity to look into that, but have you guys heard of anything like that? And the reason is that if a person gets this kind of treatment, then I understand they never need glasses. And some of our members invoice the city for sunglasses that are prescription and other kinds of prescription, and they get evaluated yearly, and it's another cost. And I don't know if that adds up, if it's any better having laser versus those kinds of continuing bills.
The one thing that I will say, Ed, is that even if you have LASIK, you might still need glasses, because what happens when you do LASIK is then your close vision still tends to continue to get worse. So just because you get LASIK doesn't mean that you will never need glasses again.
I see.
And I know that's because I've looked into LASIK for myself.
Yeah. Okay,
Hey,
I
Ed.
was just curious.
But that does pose a great question, because I was asked by the same member about that. And so what is the board's feeling on covering LASIK?
Okay, I had LASIK in.
Sure. Go ahead, I'm sorry.
Okay, so I had LASIK in 2000. I didn't need any attention to my eyes until 2020 or later. That's when my eyes started to degenerate again. I had astigmatism and scar tissue, stuff like that. So that stuff was taken care of. And you are right. I did have, I guess I'm farsighted. So I needed the nearsighted glasses or whatever. And but definitely took away the need for any eye exams, glasses, contacts, anything. So I think in the long term, it was a good investment. It was free because it was in the military, but so I think I'm all for it. And the price has been reduced significantly over time. I mean, it's down to like under our threshold. So yeah.
So that might,
perhaps we
I think
might,
the re-
perhaps we might.
referring to LaTeX.
Oh, sorry.
That's all right, go ahead.
Go ahead.
Go ahead, Bob.
I was interested in that reflective lens exchange rather than the LASIK, because the LASIK just prolongs the inevitable, but that REI will eliminate the need forever for glasses. So it's probably what your member was asking you about, Ed, and I understand that's quite expensive, and I understand that it's not covered by most medical plans. So is that what they were asking? Not the LASIK, but the reflective eye surgery or lens surgery?
I think mine was, the member that talked to me was LASIX.
Okay.
The reason most insurance companies don't cover it, and Medicare even does not cover it, is because they consider it not to be medically necessary,
Right.
because you can correct it with glasses. So
Correct.
that's why insurance doesn't typically cover it, unless you're in the military, Smitty. But you get a little
Well,
more coverage there.
Yeah, exactly. But they also did say that age is a factor. So they, like LASIK was an option, PRK, which is just laser your eye, and then that's can only get that one time. LASIK, you can do it multiple times.
Oh.
And then yes, is it medically necessary? It can be corrected by glasses you were issued.
Yeah, that was my only concern. I think if we should probably draw the line whether or not it's. I would want to hear. I want to hear the justification for having an elective surgery. I'm not quite sure that we should pay for elective surgeries.
When it comes to LASIK though, I think if it's under the threshold, just to be clear, if we had a member who, got the LASIK done and it was, I don't know, it's less than 3,000 from what I heard from.
Is it really?
Yeah,
Yeah, depending on where you go.
yeah.
It's like 2,500.
Yeah, so if that is the case, my assumption would be that we could approve that since it's under the threshold. But if we got a request for what you're describing,
Yeah.
we
Which
will
is-
bring that to the board first.
Yeah, which is 25. 25 grand.
Yeah.
No.
Mhm.
Wow. Yeah. The member that asked me about it had it done a year ago, I think it was, or more. And I said, well, no, nice try. We're not doing retroactive. So I just spoke up for the board, assuming that's would be the case anyway, but yeah. But it did pose a good question about future and being under the threshold for laser. I'm totally okay with that.
Yeah. Yes.
Yeah, it sounds like everyone's pretty comfortable with that then.
One item that I did want to bring up, and it's just more of a, I think, reminder, because I think we might have shared this information last year, but we do have a program here that we're piloting, the Ready Rebound program. And I did send out a reminder to staff this morning because we have new employees starting, and it is a great resource, but it is available for retirees and family members of retirees, which is to call this, it's a concierge, basically, service. If you get injured or a family member is injured, they will triage that over the phone and put you in contact with medical providers very quickly in the area. They'll want to know what your insurance is, but they're really good at navigating like what your insurance covers, what providers within their network work well with your insurance. We're getting a lot of great feedback from our employees right now that have used the resource. They're basically, your advocate, walking you through the treatment steps that you're trying to get seen for. We just recently had an employee with a child who had an injury, and they used them for that. They found out there was a resource here locally they didn't know about, and were able to be seen within 48 hours. And Then the advocates follow up with the family member after a few weeks, just to make sure everything's going well. So it is a really good resource. We're piloting this program through September of this year, at least. I mean, we purchased it last year, but I just wanted to make sure the board remembers it is available for you to use. And if you don't yet have the number for Ready Rebound, Jenny will provide that to you all after this meeting in an email.
And that would be to all of our 10 members then.
Yep.
Yeah, that would be great. And I know Regents,
Right?
And their
And
families.
families. That's
yeah,
good.
and Regents Regents Med Advantage has a 24 nursing number as well that we can call for anything that comes up. That on top of that, I'm just saying.
Yeah, some of our current officers, police officers who've been using Ready Rebound for injuries also have had really great reviews. But some of them, because, you know, unfortunately, the job does injure a lot of folks, have preferred providers. And that's another thing that you can let Ready Rebound know is if you have like an orthopedic surgeon that you've seen before, this is a reoccurring issue, you tell them up front, like, I really want to see Dr. So-and-so, I've seen them before. You know, I like their services, and they'll try to get that person into their network. I mean, they're always constantly expanding their network, adding in medical professionals. But the nice thing about Ready Rebound is they basically vet those providers on, you know, bedside manner, reputation, you know, all the feedback that comes from patients and clients and their ability to see patients and treat them well. So, you know, we definitely want to make sure that everybody who's eligible uses the resource if you need to. Not that I'm hoping for anyone to have an injury, but I just wanted to make sure that you all knew it was there.
Excellent. Anything else?
No, just a quickie question, Jenny. When it comes to our hearing aids again, I just want to make sure all of our 10 members know that they're to go through the Regents Med Advantage for those, and not some outside thing, even though I know RCW wise would probably still be in this pickle over that. But my concern is that True Hearing, which I've gone to myself, works very well, and it really cuts down on the cost of the city if our members follow that.
Yes, that is something that I talk about with people when they reach out to me. So I let them know to check through the Med Advantage first. And then we kind of go from there. That's kind of my answer on any claims, really, is check with that, see what's covered and what providers are available, and then we kind of go from there.
You bet. Yeah. Thank you very much.
Yeah, you're welcome.
All right. Anything else? All right. Well, thank you, everyone. We will,
Public comment.
public comment. Do we have any? We don't have anyone. from the
John, do
public.
we have anybody from the public that's joined us?
No, we have no one from the public.
Okay.
Great, thank you. In that case, I will call this meeting adjourned, and we'll see everyone for the next meeting. Thank you.
Okay. Thank you.
Thank you.
Bye, everyone.